there everyone, welcome back to Studying with Stephanie. Today we're going to talk about connective tissue proper and the different elements and properties of healing when it comes to this type of structure. When we're talking about connective tissue itself, there are 4 different types of connective tissue. We have bone, cartilage, blood, and connective tissue proper. In today's video, we're going to focus on connective tissue proper, but look out for the cartilage and bone videos in upcoming sessions. When we talk about connective tissue proper, we're talking about things such as muscle, soft tissue, and fascia. Now, what is connective tissue proper? Well, it's a structure that's made out of 2 different elements. It's made of fibroblasts and it's made of ground substance. Fibroblasts themselves are protein molecules and cells that help to build collagen up. Collagen is a wave-like structure that creates integrity and holds a structure for our body tissues. Collagen itself, like I said, is wave-like. So what happens is it creates this strong and tensile strength that when it gets pulled on, the waves kind of flatten out and hold strong together through these cross links to provide our body with structure and stability. Now, collagen is made up of a smaller molecule called tropocollagen, and its metabolic turnover is about 300 days. What this means is if we injure collagen structures, it can take up to 300 days for that collagen structure to go through its whole cellular process and get back to its original type of integrity that it had before the injury itself. So think about injuring any type of collagen structure can take a long time to heal. It doesn't mean that it's not going to be strong in 6 to 12 weeks, but it means that for about a year, it's really working on trying to regain and get back to its normal and its baseline values. And then fibroblasts also, not only do they create the collagen itself, but they create elastin, which is a stretchy like molecule, and this we can find in our earlobe, we can find it in our skin, in our blood vessels, and in our lungs. So elastin are also built by fibroblasts. Anytime we're talking about cells and you hear the word blast, think of blast. B is build. So these are the cells and the molecules that are building the structures in our body that are helping us to develop and regain and get back to our baselines when we are injured. All right. So the fibroblasts build collagen. They build the elastin. So now we have tensile structure and integrity, and then we have that stretch-like substance so that our body doesn't just get injured, that it does stretch. And then the fibroblasts also build reticular fibers. If you think back to biology, any type of reticulum is a network. So the reticulum, the reticular fibers create this network and these cross links between the collagen fibers themselves, which help to create, again, the structure and the integrity and that communication amongst all of these tissues to all flow through one. And I'm sure if you're a PT or PTA student, you've heard that our fascia, connective tissue, goes throughout our entire body. It surrounds all of our tissues. So we really need that structure because it surrounds the tissue. So it creates these different types of boundaries. But also, again, we need that elastin in the connective tissue proper to help us stretch so that we're not lifting our arm and getting stuck right here. We need to be able to elongate. These collagen fibers need to straighten out and go from that wavelength to a little bit of extensibility. Collagen itself can stretch about 6 to 8% before there's any failure in the tissues. So it's a small amount of stretch that this has. These wave-like structures are really important when it comes to our bodies. So we're going to go now to talking about the ground substance itself. Ground substance is what it kind of sounds like. It's more of a foundation. It's the thing that these collagen fibers rest in. It's a gel-like viscous type of material, and it's made up of proteoglycans and glycoproteins. These are large protein molecules, and what they do is they help to repair adhesions, and also they attach to water through glycosaminoglycans or GAGs. These are hydrophilic sugar molecules. They are polysaccharides, so it's a hydrophilic sugar molecule. It attracts water. So this ground substance, because it has proteins in it and because it has water in it, is more of a gel-like material, and this is where those collagen fibers start to lay down. When it comes to the ground substance itself, though, it has a metabolic turnover of 2 to 10 days. So the cross links from those reticular fibers and those collagens starting to connect to one another, if we do not mobilize, if we're immobilized essentially for 2 to 10 days, this is when we can start getting those hypomobilities in the soft tissue, because the structures are not getting stretched and elongated and relaxing. That wave-like structure is not going through the process of stretch and relaxation. So that ground substance is essentially stagnant. So the water is not moving through the ground substance well, and the collagen starts to adhere, and those proteoglycans and glycoproteins are there to help break down those adhesions. But this is why not only is hydration super important to our bodies, but movement is super important during those initial phases of injury, because these processes at the small cellular level between the ground substance and the fibroblast really start to take place and initiate where we're going to start off when it comes to our healing process. So movement is very important. Hydration is very important when it comes to our ground substance and our fibroblasts in the connective tissue proper. We're going to go ahead and talk about the phases of healing when it comes to connective tissue proper and soft tissues themselves. Now, we're going to negate bone from this and tendon from the soft tissue healing, because those are a little bit more in depth in their healing, and it takes a little bit more time for tendons and bones to go through their metabolic processes. So we're really talking here about more of the muscle, ligaments, fascia, those soft tissue structures that are a little bit more linear type structures. So when we go into the phases of healing, there's typically 3 phases of healing. We have our inflammatory phase, our proliferative phase, and then our maturation phase. The inflammatory phase is that initial, I fall down, I hyperextend my arm, and now my body is going through this inflammation phase. This can take 1 to several days after the injury to start to occur. What happens during the inflammatory phase is those fibroblasts get triggered and they come into the injured area to start building new tissue. And as this is happening, the tissues themselves increase in their permeability, meaning they're allowing more molecules to come in and out of the area. And this can also lead to increased tissue edema, because now there's more of the inflammatory cytokines and those type of molecules that are in the area and starting to clean up during this inflammatory phase because of the increased permeability of those capillaries and of those tissues. Then, as well, during this inflammatory phase, our white blood cells, our defender cells, come in to help clean up and break down whatever type of injury is in the area. So they're really here to help to clean up and heal this area. And then that's what starts that cleaning up and the healing process during that inflammatory phase. And then we get into the proliferative phase. Proliferative, I think of things like proliferative, pro-life. We want to develop, we want to bring new tissue, new life to this injury. So that's exactly what's happening. This can be anywhere from 4 to 5 days after the injury to months after the injury. And what's happening here is there's now an increase of capillary. New blood capillaries start to come into this wound. And this wound also has a new laydown of fibroblasts. So those fibroblasts are laying down that collagen. The ground substance is helping to repair, and those capillaries are bringing blood to the area so that new tissue can start to lay down. During this time, that's when the granulation, that really rich red, very, very high in blood and oxygen tissue starts to lay down. That granulation tissue starts to form in that injury. And then as those fibroblasts are laying down new tissues, it's laying down new collagen. That collagen is starting to form. But in the initial stages of injury, the tissues essentially are throwing the collagen at the injury, just trying to give it as much. It's like if you're on a line and you're just trying to get all of the products moved as quickly as you can. You're on that supply line and you're just throwing those boxes down. You don't really care. You're not going to organize it right now. That's what's happening. Your fibroblasts are just throwing collagen at this injury. It's like, here you go, here you go, here you go, lay it down, and then we'll worry about organizing it later. So the collagen starts to lay down in a very unorganized fashion. All of those cross links, all of those waves are already formed in that area, and the wound starts to form scar tissue, and that scar tissue starts to contract. So the wound starts to get a little bit closed down, and this is what's happening during that proliferative phase. All those new tissues are starting to contract the wound, close it, get it closer together, and all of that collagen is starting to repair and create new tissue structures themselves. And then we get into the maturation phase, which can be anywhere from months to about a year. Like I said, collagen laid down in metabolism can take up to 300 days. So this can be anywhere from a few months to a year after the injury actually occurs. And what happens during this phase is there is a continued synthesis of collagen. It's not as quick as it was in the beginning. And what's happening is now that collagen is adapting to the lines of stress. So as we're moving, as we're starting to really extend and bend our arm, those collagen fibers are starting to orient themselves and say, these are the lines of stress. This is the direction that our body wants our collagen to lay down in. It doesn't want it just a hodgepodge, a mix-up. Now we're really organizing those tissues. And then from there, the scar tissue starts to increase in its strength, and it's increasing in strength in regards to the demand that's imposed on it. So as our body now, we're starting to use those muscles a little bit more. We're starting to use those tissues, putting more weight into it. That scar tissue and that new tissue is going to say, hey, well, now we need to grow in strength as well. So it's starting to increase its strength based on the demand that is imposed on it. And this is why progressive therapy treatments are so important. We can't keep people at the same level because their scar tissue and their new tissue is only going to increase and develop based on the demands that it is put through. And then, like I said, those collagens are nice and oriented now. They're starting to go into the direction that they need to go to have proper mechanics and movement in our body. And as this all happens, the inflammatory phase, the proliferative phase, and the maturation phase, like I said, it doesn't mean that 300 days, it's going to take us a whole year to recover from this injury. No, at about 2 weeks, the soft tissue has about 50% of its healing completed. At about 6 weeks, we're 80% healed, and at about 12 weeks, we're nearing that 100% of healing. But just because we're healed and the proliferative phase has pretty much taken its course doesn't mean that we do not still have to go through that maturation phase and give these tissues the loads and the movement that they need to adapt to the stresses. But if you think of these timelines, 2 weeks, 6 weeks, and 12 weeks, and you go to any type of post-op protocol, you're really looking at, okay, 2 weeks, we're really not going to do too much with this patient. It's all going to be pretty much passive motion. And then 6 weeks, hey, all right, they're about 60% healed. Sorry, they're about 80% healed at this point. So now we can start pushing those structures, giving them a little bit of load so that they can start moving active range of motion. We can start getting those collagens to line up. And then at that 12-week mark, anytime you're looking at post-op procedures, the 12-week mark is when you can start actually giving people some more resistance. You can start pushing them in their programs. So this is why those post-op protocols go through these timelines pretty much, because of those healing phases of the soft tissue around it. So kind of think of that when you're going through your cellular processes. Think at the post-op protocols when you're seeing these people come in. Well, why can I progress them to AROM at 4 to 6 weeks? Why can I progress them to resistance and to higher level activities at that 12 weeks? Well, it's all due to how our body heals and the processes that our soft tissue and connective tissue goes through. All right, like I said, in these follow-up videos, we're going to go into cartilage, we're going to go into bone a little bit more in depth as well, so that you can really get an idea of these different types of tissues and what their healing properties are in relation to physical therapy itself. Thank you so much for joining in today. I really appreciate you being here. If you have any questions, comments, please drop them below in the comments. If you thought this was helpful, please subscribe and share it with your friends and peers. And if you would like one-on-one tutoring, please drop it in the comments below. I will reach out to you and I will be happy to help. Thanks again for coming to Studying with Stephanie.